call him a national treasure or an American hero is true, but also too limited for someone who has saved millions of lives in this country and millions more around the world. At least 25 million in Africa alone by the work he did to stop the spread of HIV/AIDS and to help develop treatments for HIV. And he did all of that years before he saved millions of lives around the world during the COVID-19 pandemic. Dr. Anthony Fauci treated patients with communicable diseases throughout his career in the early stages of our understanding of those diseases when we didn't actually know how they were transmitted. There were doctors who were afraid of treating AIDS patients before we knew how the disease was actually transmitted, but not Anthony Fauci. Dr. Fauci treated Ebola patients when we knew that the slightest bit of contact with an Ebola patient could be deadly. When there was panic here in the United States about Ebola, Dr. Fauci made the deliberate choice to publicly hug a nurse from Texas who had contracted the disease to prove to everyone that it was safe to welcome her back among us after her successful treatment. Dr. Fauci has traveled to malaria zones in Africa repeatedly over the course of his career, accepting possibly grave health risks in his career of healing. It was in his backyard at age 83 that he got hit with an infectious disease from what he calls, quote, the deadliest animal on the planet, the mosquito. Dr. Fauci tells the story as an important public health warning in a new guest essay in the New York Times. Quote, I began to experience unexplained severe fatigue and exhaustion, culminating in my admission to a hospital on August 16th, delirious and incoherent with a temperature of 103 degrees. I remember little of the 5.5 days that I spent in the hospital, except that I had never felt so ill in my life. My physicians assumed that I had sepsis and treated me with antibiotics. After several days, my fever subsided and I was discharged on antibiotics without a clear diagnosis. So, the most famous and accomplished infectious disease specialist in the world is hospitalized, getting state-of-the-art medical treatment, and they misdiagnose his illness. We've all heard stories of people's illnesses being misdiagnosed or doctors simply not being able to figure out what the problem is. And if anyone dear to you has ever told you one of those stories, you know how terrifying it is when the world of modern medicine is confused and cannot figure out what the problem is, when they seem to be able to know everything in medical science. But lurking behind those stories, when you hear them anecdotally, is that feeling that maybe the doctors just didn't try hard enough. Maybe if the patient were a more important patient, there would not have been a misdiagnosis. But Dr. Fauci's story proves it could happen to any of us at any time, and it is impossible for doctors to always know everything. The day after Dr. Fauci was discharged from the hospital, Dr. Fauci writes, blood tests revealed that I had West Nile virus. There is no treatment for West Nile virus disease, and I was left to deal with its toll on my body. It was terrifying. I could not swing my legs over the side of the bed to sit up without help from my wife and 3 daughters. I could not stand up without assistance and certainly could not walk. A very scary part of the ordeal was the effect on my cognition. I was disoriented, unable to remember certain words, asking questions of my family that I should have known the answers to. I was afraid that I would never recover and return to normal. At my age, 83, I was at risk of permanent neurological impairment and even death. Joining us now, I'm happy to say, is Dr. Anthony Fauci, former director of the National Institute of Allergy and Infectious Diseases. He also served as chief medical advisor of COVID-19 in the Biden administration. He is the author of the best-selling and important book, On Call, The Doctor's Journey in